High blood pressure can make you feel like you are stuck in a stuffy airplane with no oxygen mask inside, and your chest as if you have a boom box right next to you. But this is a sign that you may need to take your blood pressure seriously. Hello guys, I'm Dr. Khan, blood pressure boss. Hypertension, also known as high blood pressure, is like a ninja silently sneaking up to you. This stealthy condition unfortunately affects millions of people all over the world, but unlike ninjas, it doesn't come with the cool weapons, the nunchucks, or any sharp-looking outfit. And if you don't treat it properly, it can cause serious health conditions, so it is important to know what you're looking for. In this video, we will talk about the 5 top alarming signs that your blood pressure is skyrocketing that you should never ignore. So stay tuned to learn how to protect your health and well-being, my friends. The first and the most common could be that you are experiencing headaches. A headache is a common sign that your blood pressure could be too high. If you have a headache every day, especially if it comes with some neck pain, it could mean that your blood pressure has become too high. The blood vessels in your head can get bigger and swollen when the pressure is high, and this can cause painful headaches. High blood pressure can also cause headaches by cutting off your blood flow to the brain. That could also happen because your blood vessels try to constrict itself, and that leads to decreased blood flow to your brain. So this leads to less oxygen actually getting to your brain, and the more headache you will experience, but the less oxygen coming to your brain. Now there is something called malignant hypertension, or really high blood pressure, and normally this happens if your systolic blood pressure is over 180 or your diastolic is over 110, 120. This could be significantly serious, and as the blood pressure goes up, the pain in your head can also go up. If you have this type of malignant hypertension and you're having all these symptoms, then you need to control your blood pressure right away and even call your doctor or get to the emergency department as soon as possible. Now, the second alarming sign of high blood pressure, and take note of this, you could not catch your breath. You are short of breath. High blood pressure can make you feel like you are stuck in a stuffy airplane with no oxygen mask inside. If you have high blood pressure, your heart may have to work harder to pump out the blood, making your body feel like it is running low on air. When the pressure in the heart chambers goes up, the walls of the chambers get thicker, and this can cause blood to pool in the lungs as well, because your heart is unable to push the blood out appropriately. When your lungs fill up with fluid, that certainly means that you're not having the oxygen and carbon dioxide exchanging in your lungs. When this happens, of course, you are going to have a low oxygen level and you are going to feel as if you can't breathe. Now, sometimes this can get so bad, and we doctors call this pulmonary edema. And this is the time to head to your doctor before things get any worse. The third alarming symptom that could suggest you have high blood pressure is you cannot see clearly and your vision suddenly changes and gets blurry. And sometimes if you have an eye exam, your ophthalmologist, your eye doctor can actually pick that up. High blood pressure can hurt your blood vessels that bring blood to your eyes, which can also affect your vision, of course. The increased pressure can make the blood vessels leak, which can cause the eyes to swell and make it hard for you to see. When your blood pressure is high, you could also have something called increased intracranial pressure, basically meaning that the pressure in the brain is also higher. This leads to your brain possibly getting swollen as well. This can all cause vision problems. In severe cases, especially in older adults, high blood pressure can make it hard to see, especially at night. This is called hypertensive retinopathy, and you need to see a doctor and an ophthalmologist right away. The next sign is that you are experiencing nausea. You are experiencing nausea and sometimes even vomiting. Now, nausea is not a common sign for high blood pressure, though it has been proven to be an indicator. Some medications used to treat high blood pressure, like diuretics, can also make you feel sick in this situation. In some cases, nausea can also be a sign of a more important or a serious health problem like heart disease or kidney disease. This can all be caused by high blood pressure. And when your blood pressure goes up, your heart pumps less blood. So less blood goes to your organs. That makes your heart work harder and sends less blood to your arms, legs, and the brain. And in this scenario, if your brain isn't getting enough oxygenated blood, that makes you feel sick. And the fifth and not the least, your ears and chest could be pounding. Your vessels near the ears or the chest is pounding and you're not even on the dance floor. So it could be high blood pressure. High blood pressure can cause all of this to happen even when you're just sitting around and relaxing. And when your blood vessel pressure goes up, it can make your heart beat faster and harder, giving you that pounding feeling. This can be especially felt in your ears and your chest, as if you have a boom box right next to you. And when you have big boom boxes right next to you, you feel as if your heart is beating, right? And you could also have your head bobbing back and forth, but you don't have any boom boxes in this situation, and it is your high blood pressure. So keep calm, take a deep breath, and get help. Check your blood pressure, talk to your doctor as soon as possible. All right, so there you go, the 5 red flags that we need to watch out for, because this can be signs that you have high blood pressure, and high blood pressure that is significantly bad. And don't let hypertension take you by surprise. Be proactive and check your blood pressure regularly. And if you really want to work on your blood pressure, I have a detailed course which I call the Blood Pressure Boss course. It will get you the knowledge that you need to correct your blood pressure. It goes over aspects of the physiology of blood pressure, as well as natural treatments and supplements and exercises, all of this without medication. And you can start doing this right now and today, because it is readily available. And if you are taking medication, it goes over the uses, the most common side effects that you should know about. You have the whole course. So the good thing about this is you have the whole course available to yourselves. You can watch it whenever you want. It is also so economical that everybody can afford it, and it is the same price as a regular dinner outing. Although I feel that the value you will get is truly priceless, it will get you in the mood to fix your blood pressure. That's the real benefit, in my opinion, and you will take your health seriously and give yourself the motivation that you need. I also have motivational videos in that course. Thank you so much. Talk to you guys soon.